Wonderful. We are going, right? Welcome. Good afternoon and welcome to the Health and Government Operations Committee briefing. This is a virtual committee briefing, so I ask for your patience if we encounter any technological or streaming issues. This briefing is being streamed on the Maryland General Assembly's YouTube channel. Committee members will be muted throughout this briefing. If you have a question after the presentation, please use the raise hands function, which is located either underneath the participant list on the right side of your screen or under the reactions bar at the bottom of the screen. I'll call on delegates to ask questions. After we call your name, please wait a moment as Melissa unmutes your screen. Remember, even though we're meeting on Zoom, please adhere to our usual committee rules. One question and one answer from the panel, not one question and one answer from each individual panelist. Also, please keep your questions shorter than the expected answer. Today, the HGO Committee will receive the fiscal briefing from colleagues at the Department of Legislative Services. First, we'll receive a fiscal overview briefing from Simon Powell, Senior Budget Manager at the Department of Legislative Services. This briefing will be followed by a Q&A session. After that, we will be receiving a briefing on the Maryland Department of Health's budget overview from Ann Wagner, Senior Policy Analyst, and Andrew Garrison, Policy Analyst at the Department of Legislative Services. This presentation will also be followed by a Q&A session. Please keep in mind, this briefing is scheduled to conclude by 2:30. Mr. Powell, when you are ready, you may begin.
Great, thank you very much, Delegate Kelly. Melissa, can you pull up the... Thank you. So I'm going to run through the fiscal briefing that was presented to the budget committees last week. You may have just noticed it's a 65-page document. I am not going to present 65 pages. I'm going to zip through it pretty quickly. Again, if I can't answer questions that you have, I'll get the answers back to you as soon as I can. So let's just take a look and start with the quick look of the budget. The top line is that the budget plan for 21-22 shows that the fiscal 22 budget actually declines 2.1%, just over $1 billion in total funds. And what's important, and I know this is a bit of a budget wonky thing, but it's looking at those specific fund types that make up the total budget. It's kind of interesting this year. You can see specifically that general fund need actually in fiscal 22 is much higher than fiscal 21. And special funds and federal funds in particular decline. That's because the 21 budget actually contains a lot of the federal stimulus funds, federal CARES funds that we've received. And fiscal 22 really doesn't contain any of that kind of funding. I should point out specifically that right now there's no funding in the budget that was passed in the December Federal COVID Relief Act. And there's also no funding, obviously, from what might come in the future from the current administration's proposed relief plan. So right now, this is how the budget looks. It's going down from 21 to 22, mainly because a lot of one-time support that we got in fiscal 2021 is going away. And we'll get into that a little bit more in a moment. But I should caution that a lot of this, the numbers on this page will likely change pretty dramatically if you're looking at them again in the future, because there's a lot of potential changes out there. I think it's important to note that one of the things that the fiscal 22 plan is accommodating is a significant proposed fiscal relief plan from the administration. You know about this right now, the Relief Act of 2021. It proposes over $600 million worth of general fund of tax relief, which basically means general fund revenue decline. So the budget not only has to accommodate the need to offset a lot of the funding that we're going to lose in 21, it also has to accommodate this proposal from the administration to reduce taxes. So we move to the next page, please. I'm not going to go into the specifics and the details of the bills because that's really kind of beyond this kind of briefing, but this just highlights what the governor is proposing in broad brush terms. Extending the earned income tax credit in fiscal 2021, and also, the sales tax vendor credit. So the specific things that the governor's trying to accommodate. Now, if we look at the bottom of that page at the bottom of page 2, you can see what the end balance for the budget would look like before we consider any of this external legislation. It would be unbalanced by about $200 million. I will note that that's a lot better than we were expecting at one point. I mean, I think you can all cast your minds back to April, May, when people were talking about considerable cuts that we're going to have to take in fiscal 2021 and 22. As it turns out, and I'll show this a little bit in a moment, the economy didn't do as badly in Maryland as it might have done. And so our end position is not so bad. It also reflects the fact that the governor took those cuts to the Board of Public Works in July. But if to accommodate what the governor is proposing in his Relief Act, we still need a buffer. In other words, we've still got to go and have that separate piece of legislation to go in and find over $1 billion worth of revenue in order to get to the position that the governor's proposed at the end of fiscal 22, which is a $200 million fund balance. So without that tax relief, the buffer would not need to be as big, is what I'm trying to say there. But because of the tax relief, the buffer is a much larger bill than it might otherwise be. If we go to the next slide, please. This just presents where we think the budget is in terms of structural balance. The Spending Affordability Committee, which is the committee that guides the legislature in terms of how they want to see the budget, set the governor a task of balancing the budget and having a $100 million fund balance, which I've just shown you he more than exceeded, and also to reduce the structural deficit. Actually, their suggestion was to have a structural deficit of about $700 million. So clearly the governor exceeded that. So at this point, we know we're not looking, in terms of the out years, the structural outlook doesn't look too bad, but more importantly, the structural, as the governor submitted the budget, it met the SAC guidelines. So if we move on, please, Melissa. I think we can continue now to page 6. And this is where I want to highlight some of the things that are especially more pertinent to your committee. This is what we call the session to-do list. This is all the stuff that's in the buffer and other pieces of legislation that kind of coalesces to form the total budget plan. So some of the things that are in the buffer and have to be done are to allow a transfer tax diversion, $100 million plus. But in this particular instance, the governor is going to replace that spending with general obligation bonds. So support for things like program open space, MABITCO, all of those kind of things which the transfer tax would normally support, instead will be supported by general obligation bonds, and that frees up general funds. There's a change also to the revenue volatility adjustment, which is an adjustment that's in place to kind of smooth out tax collections based on high income earners who have a lot of capital gains earnings, which tend to be quite volatile. And we're basically pushing that out, or the governor's proposing to push that out for a year, and that produces an extra $80 million worth of general fund revenue in 2022. Something that you'll be interested in is the governor's proposing to reduce the exchange mandate. The exchange has had a mandated $35 million appropriation for quite some time. It hasn't been spending $35 million in recent years in terms of the special funds. And last year, you might remember that the legislature agreed to a $3.5 million cut to the exchange's mandate. The governor has come back and proposed a reduction of the mandate to $32 million in fiscal 22. The rest of the things there that are starred are all part of the governor's Relief Act and also additional tax relief that he's proposing. So that's all things that your sister committee down in Ways and Means will be looking at. If we move down to the bottom of this particular page, you can see some technical adjustments that are included in the buffer, but I also want to note again, the governor is delaying a repayment to program open space. This is a repayment that dates back to the last Great Recession that we're still, as a state, trying to make. And again, the governor's delaying that by a year, which produces general fund savings. And there are also provisions in statute that require certain monies that are available at the end of each fiscal year to be swept into the pension system, as well as to offset retiree health liabilities. And the governor's proposing to take those away and not do those transfers in the buffer. Let's go to the next page, please. This is a list of contingent reductions and fund swaps that are included in the BRFR. Some of the things here of interest are the governor's decision to level fund the Selinger formula that supports private colleges and higher education institutions. Essentially, that funding level is the same as in fiscal 2020. The governor and the Board of Public Works took another cut to Selinger in July Board of Public Works meeting. So this essentially level funds the Selinger formula at the fiscal 2020 level. The governor is also proposing to reduce the amount of increase in the CADE community college formula. It's going to about 5% growth, which allows a 26.6% cut. Level funding the Arts Council, and that's something that the governor proposed last year. In each case of those first three, I should also note that it's not just a question of the governor proposing cuts in fiscal 22. He's also proposing to change the way the formulas work for that funding in the out years. For most of the past few years when we've had BRFRs, the General Assembly has, when they've had to go along with cuts in the BRFR, they've tended to not want to change the out year funding formulas. So there's two provisions there. I think it's important to note you're not just talking about the cuts that are being proposed in fiscal 22, but it's also the changes to the way those formulas work in the out years. So those are both two types of decisions that the committees will have to look at. Moving down this chart, I'll highlight the $200 million number in terms of fund swaps. This is a number that's going to be very important to you, I think, as a committee. You all will remember when the individual insurance market on the exchange was facing calamitous premium hikes back in 2019. Your committee, along with finance, set up a reinsurance program and funded that reinsurance program through a tax on certain healthcare insurers. That tax, which you imposed in fiscal for calendar 2019, and also then changed for calendar 2020 through 2023, is going to raise, we think, about $800 million. Now, as it turns out, although at the time the decision to raise that revenue was based on the fact that we thought the state would have to make a contribution to that reinsurance program, it turns out that it doesn't look like we do at this point, because the federal government is providing sufficient the federal government's getting sufficient savings from the reinsurance program, and they're returning that to us to actually fund the entire reinsurance program. So there's going to be potentially $800 million sitting in this reinsurance fund in the exchange. And the governor's proposing not only just to take $200 million away in fiscal 21 and 22, he's also proposing to take another $100 million a year from 23 to 26. So in total, reducing $600 million out of that pot of the $800 million that we think will be available. Now, I don't think at this point, based on the data we have, that it's going to affect the reinsurance program, which, as you know, runs through calendar 2023. But it will certainly impact the ability of the exchange or the legislature to use those dollars in a different way to affect changes in health insurance coverage. Right below that $200 million is another an old-time favorite, which is the deficit assessment. We've had a deficit assessment, which is the tax essentially on hospital revenue. We've had that in place since the last Great Recession, when we needed to find a way to support the Medicaid program. The hospitals have been paying this assessment since then. It was as high as $390 million at one point. Last year, when you left Annapolis, the assessment was about $295 million and was going to stay at that level permanently. The governor in the Board of Public Works action in July and also in fiscal 22 is essentially proposing that assessment be increased to $330 million, which basically means that there's $35 million worth of general fund savings in 21 and 22. And the governor's proposing to keep that level in the out years. Below this are a series of fund swaps, again, areas of interest for your committee, I think, because a lot of these come from the health boards. These are essentially things that we see quite frequently nowadays, where the governor goes into the fund balances in various health boards and takes those fund balances, and they do try to apply them to areas where they think there is some kind of like policy connection. But the bottom line is it's just grabbing money from funds to support general fund spending. So that's what we're showing there. If you move on to the next slide, please. Just want to note there are a couple of special fund actions in the BRFA which are important because they do save us general funds, and I just want to point out a couple of these actually. And again, there's some which will be of interest to the committee. At the top there, the governor's proposing to use the marketplace facility revenue to cover the shortfall in the Education Trust Fund. The Education Trust Fund was short because of the lack of casino activity in 20 and 21. So that he's proposing 175 million be moved for that. I'd also point out that for those in the Washington metropolitan area, the governor's had this contribution for WMATA in recent years. That's still being supported in fiscal 22, but it's being done through bond premiums that we get from selling our bonds at a favorable rate. So no general fund support, but there's still going to be support for WMATA, except through the use of a different fund source. And I also note there that the Community Health Resources Commission, which is funded usually at around $8 million, and fiscal 22 is going to be funded at a lower rate because the governor's proposing changing the way that the funding from the Care First premium tax exemption goes to support the Community Health Resource Commission and the Senior Prescription Drug Assistance Program. That's something that was proposed last year that the legislature rejected. At some point, that may have to actually kind of be looked at because the Senior Prescription Drug Assistance Program is spending more money now than it used to. So, that's something that we'll be looking at as we move through session. If we go to the next slide, please. I'm not going to get into this in great detail. This is just how the governor's proposing to use the Blueprint Fund in the fiscal 21-22 budgets. I think the bottom line on this is that regardless of basically how the governor's proposing to use the fund, the expectation though is that the fund will still be able to support all the Kerwin spending that you all want to do, assuming you override that veto, all the way through to fiscal 2025. It's only in 2026 that there has to be some kind of general fund addition there. And if we move to the next slide, this just provides the specifics on how the governor's using the Blueprint funds in fiscal 21 and 22. Let's skip to page 13 if you can. That's it, thank you. So this chart just gives you an overview of the amount of funding that the state has received, both in the original CARES Act funding as well as in the December federal stimulus. It does not include additional SNAP benefits, which are over $1 billion. And it also doesn't include unemployment insurance benefits that Maryland citizens have received, which total over $7.5 billion. But clearly this just is intended to give you a broad perspective on the extent of the funding, the state and federal stimulus funding that's been received from this received in the last 12 months. If you go to the next slide on page 14, this is the specifics of the December federal stimulus package. Again, I'm not going to go into this in great detail, but I just want to tell you what's important here from a budget perspective is that it's really the number on the bottom line about the funds that should be eventually included in the state budget. We're expecting an additional $1.3 billion plus at some point has to flow through the state budget, be it in fiscal 21 or 22. And that's money that right now is not included in the governor's proposal, not surprisingly, because the funding was available so late in the year and in the budget development process. If we move to the next page, a couple of charts on the economy. I just want to point out a couple of things because I'm not an expert in the economy, but a couple of things that my colleague who is, she pointed out to me. This shows that if you look at the unemployment rate, which is around 6.8%, and I think the interesting thing here is that the unemployment rate at the peak in the last recession was about 7.8%. So we clearly went way over that in April, May, June. And although we are kind of returning to lower unemployment levels, we're still way significantly higher than we were experiencing in January through March. And I think that kind of illustrates, and we, as we talk about the budget in a little bit more in a moment, it illustrates the severe dislocation that occurred in that first few months after March. Page 16, please, Melissa. This is a chart that just shows you that, as I said earlier, our income, overall, our revenue picture was nowhere near as dire as people were expecting. You know, the controller had a briefing, I think in April or May, where he was looking at potentially $1.62 billion worth of general fund losses. We really ultimately didn't experience that. And as you can see from this chart, in fact, some of the areas of government and private sector actually experienced gains in withholding between 2019 and 20. But I think it's really important to point out, I mean, I think everybody knows this, but I think it's really important to point out when you see it in the data, that there are clearly areas of the economy that are struggling. Accommodation, food services, art, entertainment, recreation, and so forth. These areas are definitely struggling. And so in some ways, it's like when you see the kind of relief and targeted relief that people are trying to put together, you can see why they're targeting those particular sectors. If we can move on to page 19, actually, I'm skipping through a little bit. Just want to show you the rainy day fund activity. One of the things that's come up is well, we have this huge rainy day fund. This is essentially our savings account. Why aren't we using it more? And I just want to show you the extent to which the state has used the rainy day fund over the past 12 months. We started in fiscal 21 with a beginning balance at 6%. So that was the goal at the end of session, to leave a 6% balance, and the legislature did that. As you can see, the governor then used $250 million of that as part of his economic recovery initiative. And the way this ends up is we're still going to have 5% in the rainy day fund at the end of fiscal 22. So I show this because as you're hearing from your colleagues in the Senate, as they develop their proposals as to how they want to add on to the Relief Act, you know, the use of the rainy day fund is one of those proposals. And it just gives you a sense of, you know, where we are in terms of our reserves. And we've kept very strong reserves relatively speaking, and we continue to have that balance that's available. So if we turn to the next slide, I just want to go through very quickly some of the general fund changes in the budget and highlight some of the important things. One of the advantages of having this extra stimulus funding in fiscal 21 and having the enhanced Medicaid match, I should mention specifically that during this period of a public health emergency, the federal government is giving us an extra 6.2% on the federal match. So instead of getting 50-50, we get 56.2% federal match. We don't get it on the expansion population, just the traditional populations, but that's been probably the most significant. In fact, it has been the most significant area of general fund relief that the state's experienced since March. And as you can see, that those savings from the enhanced match really helped the state in the sense that in 21, in the sense that even with additional expenses related to growth in Medicaid, additional expenses related to COVID itself, accelerating the 4% provider rate increase as part of the minimum wage package from July to January, even those additional expenses were more than offset by this additional this general fund savings because we have this enhanced match. So overall, our general fund need in fiscal 21, despite the additional costs, was actually lower. If you go to the next slide, please. We don't usually show this chart, but I wanted to do it this time around because even though general fund spending in the budget goes down in fiscal 21 in terms of deficiencies, overall our budget growth from deficiencies is 2.7 billion. And this is how we begin to explain that chart on the front page which shows why spending goes down so much in 22. It's because we're adding so much money in fiscal 21. A lot of this money is relates to COVID expenses. The entitlement bar there is over $1 billion worth of spending in SNAP, the food benefit program. So this is why spending in fiscal 21 is going up so much, but it also explains why ultimately it's going to go down in fiscal 22, because, for example, the SNAP benefits are budgeted at the normal level in fiscal 22, not at the higher level. The next slide, please. This chart was just an attempt for us to see if being a general fund agency, having most of your funds from general funds, meant that you were going to have lower growth between 21 and 22. General funds, we basically kind of look at each kind of sets of agencies to see, and look at how they're funded by fund type. And the expectation, we didn't have any real expectations, but we thought, well, what if we do this, what does it show? And it actually showed that there was really no relationship between being generally funded or special funded and growth. Overall growth was pretty low. But there were two areas where we noticed that actually where there was a lot of change between fiscal 21 and 22. They were in that other executive agencies category, and that turns out to include labor, commerce, housing, and community development. No surprise that all the funding that we've received, a lot of the funding we've received in fiscal 21 has been in labor, housing, commerce. And so that funding isn't there in 22, so there's a big drop in those agencies. And the other big drop, again, is the other entitlements, which essentially is SNAP. We've received, as I said, well over $1 billion in SNAP benefits and pandemic and EBT benefits in fiscal 21, and they're not there in fiscal 22. We go on to the next slide, please. This just shows you how we're using general funds in fiscal 22. Essentially, we have to backfill for a lot of that one-time funding that is no longer available from fiscal 21. If we go on to the next slide. This just kind of gets into the more nitty-gritty of where some of the changes are. I will note that there is funding for community expansion in the Developmental Disabilities Administration. There's growth in the behavioral health area. Interestingly, a couple of bills that you passed last year are chapters 572, 576 to increase salaries at state psychiatric hospitals. That is funded in the budget at over $30 million worth of general funds. And there are some areas, though, where we are seeing savings in the budget. Public safety, we're seeing closings of a couple of pre-release units, which are going to result in some savings in public safety. And overall, I'd note that funding for University System of Maryland goes down in terms of general funds. The system took a big cut in July from the governor, over $120 million. And the funding level in fiscal 22 is not increased. However, I would point out that if you go back to, I'm not asking you to go back, Melissa, but if you went back to those slides that showed some of the funding that's going to be available in December from the federal government, a lot of that is going to go directly to higher education. So we'll have to see how it all plays out for the universities, because they have funds available. And I would note also actually that the HBCUs have an additional set of funding available under the CARES Act. So there is money there for higher education. So even though we're showing a decline here in state support, it actually kind of, it may end up that their situation is not so bad. If we go to the next slide, this just shows you statewide personnel actions, and all the different things that are in the budget. I will note there's no increase for state employees for fiscal 22. State employees will get bonuses and a small cost of living adjustment depending on revenue estimates. However, I think it's important to note that not all collective bargaining units have agreed to that. AFSCME has still not come to an agreement with the state. They've been essentially at loggerheads with the state for the past few collective bargaining cycles. And the next slide. Actually, go to the next one, please, Melissa. This just goes through state aid, local aid. I know there's always an interest in this. Generally, this is even though general fund support for local aid is down a little bit overall because of all these special funds from the Blueprint Fund, state aid is going up about 2.7%, $230 million, again, primarily in the education area. And I think it's important to say, if the governor didn't provide the funding that he's providing in terms of hold harmless, we would see education formulas, funding formulas going down in 22 because of the decline in enrollment. So essentially what the governor's doing is trying to actually preserve and hold harmless, hold the school systems harmless from the declining enrollment. And on page 28, the next slide, we have just what the individual local governments are getting in terms of local aid. And Delegate Kelly, I think I'm going to leave it there because it's already 2 o'clock and I don't want to impinge on the time for my colleagues. So I'd be happy to answer questions here. And if I can't answer them, I'd be happy to get you the answers later on.
Thank you, Mr. Powell. Do we have any questions from the committee? Raise your hand in the raise hand function. I see a couple of questions. First, we'll go to Delegate Cullison.
Thank you, Madam Chair, and thank you, Simon, for your usual thorough analysis and explanation. But I do have to tell you that my heart stopped when you talked about taking money out of the reinsurance fund. It is a program that is absolutely working. It has reduced insurance premiums. We don't know we can't predict the need. It feels like that would not be a good place for us to be tapping into, maybe in a contingency year because of, a catastrophic health emergency, we might call it. But to say, going further beyond that is very worrisome to me. So, I mean, how will we make sure that we can maintain the premium levels and restrictions without that, if we tap into that fund?
Right. I mean, I think, as I said, right now, the forecasts are that you won't need to use too much of that state funding. But you're right, that's just a forecast. It might change. I mean, clearly, I think there are two decisions that are out there on this. There's the fiscal 22 budget plan needs $200 million worth of special funds. And if you don't have that, you've got to find $200 million from somewhere else to support the budget and the budget plan. But the 23 through 26, which is the additional 400 million, it's, that helps the out year structural deficit, but it's not necessarily something that you have to kind of think about right now. I mean, the tradition, our job is to always predict out year structural deficits, and your job is to say, we'll take care of them on an annual basis, which you do, as you have to, and you always will do. So that will be a policy call, because I think, clearly the problem is you set up this fund with great intention, and it turns out we didn't need as much as we thought. But yeah, if you want to do other things with that money, then just don't do the out year funding.
Still, my heart is just barely beating, but thank you very much.
You weren't alone, Delegate Cullison. Delegate Rosenberg.
Thank you, Madam Chair. Simon, the individual benefits and other programs in the December CARES Act expire, I believe it is in mid-March. And Morning Joe said, or somebody said there this morning, that is the deadline that the Biden administration has to enact its first stimulus bill. If that's when it is enacted, will we know, how does that fit into our timetable for decision making on the budget in terms of our awareness of what we're getting from the feds and how we can oversee how it's spent by the governor?
It's a good question. Obviously, if you're still in session, I mean, the governor may or may not choose to bring that funding into the budget. There are various ways he can do that through budget amendment. I will say we have to be clear. I mean, this is the most unusual of budget years, but I mean, we're still getting fiscal 2020 budget information right now. There's still a lot of information from fiscal 2020, which closed 7 months ago. that we're still processing. So it's not as transparent as some people might like, but that's the hand that the DBM has been dealt in terms of trying to get this money out. In terms of oversight, I don't know exactly if if you're not in session, you can get the same oversight that you got during the interim, which is we get materials, we present it to you. But yeah, it is a timing issue. I mean, as I said, one of the things that's not in the budget is all the money that's there from December. So as I said, it's very difficult to know how to best oversee that, especially given the governor's budget powers.
Thank you.
Okay, we have 4 more questions, and I just want to make sure the committee is aware it's 2:07. So we have another panel after this. We have Delegate Lewis, followed by Shalega, Lewis Young, and then Delegate Sample Hughes. So Delegate Lewis.
Thank you, Madam Chair. Thank you, Mr. Powell. I have so many questions, but I'll just ask one. You mentioned that we benefited in the last fiscal year from, or this fiscal year, we're benefiting from an enhanced federal match on Medicaid, which they bumped up their match to us. Right. Does that continue in the future, or was that a COVID response?
So that continues as long as there's a public health emergency. And the new secretary, I should have mentioned this, thanks for bringing it up. The new secretary of HHS actually announced that the enhanced match will be in place through December of 21. That's important because the governor didn't know that when he put his budget together. So there is approximately $300 million worth of general fund support in the budget in fiscal 22 that will be supplanted with federal funds. So that's
supplanted, okay.
Yeah, so in other words, that's going to be another pot of money that people are going to be looking at as plans develop.
Thank you so much.
Delegate Shalega.
Thank you, Madam Chair. Hey, good to see you, Simon. Always nice to hear your analysis.
Oh, sorry, I was just trying to find you on the screen.
I know, it's like Brady Bunch. I do the same thing. Page 9, you do an analysis of the Blueprint Fund outlook. So I know, we don't have a ton of time, and I probably will follow up with you offline. But so I'm looking at the starting balance Blueprint Fund. It looks like, or ending balance in 2026. Is it saying that we need $4.8 billion?
No, basically what it's saying is that by 2026, that based on what assuming the veto is overridden, what is planned to be spent, the Blueprint Fund would be insufficient to fund all the COVID initiatives and the planned spending to the tune of about 195 million. So in other words, the Blueprint Fund supports the proposed expansion of the Kerwin legislation through 2025. And it's in 2026 that you start running into issues about potentially needing additional general funds.
So there is money in the budget for the starting balance of 3.6 billion on 2026. We actually have that money in.
No, that's
just a mandate?
That's cumulative. So what's actually kind of in the balance is actually reflected in 21 and 22, in the 21 and 22 numbers.
All right. Well, I will follow up with you afterwards. Thank you.
Yeah, thanks.
Chairman Pendergrass.
Thank you, Madam Chairman. I'm listening and putting pieces together, and I share Delegate Cullison's concern about $200 million, and I'm sure other members from the reinsurance fund going, and I think it was going to Medicaid. And now we hear that we're getting extra money for Medicaid, and we came out better last year in Medicaid than we expected to. Why do we still need to move $200 million if we expect that money to be covered by the federal government?
So again, first of all, when the governor put his plan together, he didn't know about the additional 6 months of enhanced match. And secondly, I think the best way to think about it is not to think about it in terms of, well, it's $200 million for Medicaid specifically. It's just part of the big plan of how the governor ends up balancing the budget, providing the cushion that he provides in terms of fund balance, and also does that Relief Act funding, because the Relief Act funding basically reduces general fund revenues, which means that you don't have general funds to support the budget. So it's all part of that big equation. It's not really specifically related to what's going on in Medicaid. It's just that's where the money goes.
Thank you.
Thank you.
Delegate Lewis Young.
Thank you, Madam Chair, and thank you, Mr. Powell, for your second rather intense presentation of the day. I believe I heard you say that there will be no sweeper for the retiree pension and health programs. If I understood that statement correctly, how will that affect our unfunded liabilities, our credit rating with the bond agencies, and our future catch-up obligations for making progress on unfunded liabilities?
So in terms of the our OPEB liabilities, which are the benefits, we have made zero progress in terms of those liabilities, and we haven't for years. The bigger liability is the pension fund liability, and that was something that, frankly, the legislature made the big strides in changing that in 2011 with pension reform. And the additional funding, the additional 25 million, for example, it's nice, but it's not actuarially required. Our pension fund system is funded at the actuarial level. The funding in the budget meets that. We're doing better than we were. I can't remember the specific percent of total liability, total funding that we have now, but it's gone up significantly. I can get you that. But at this point, those two particular transfers really don't make that much of a difference at all in terms of our bond ratings, that credit rating.
Very comforting. Thank you.
And the final question for this panel, Delegate Sample Hughes.
Thank you, Madam Chairman. Mr. Powell, thank you again for your presentation today. I just wanted to get clarity on the CAID funding. Were you referencing that the formula is changing again altogether, or there are changes to the amount of funds that are going into that at this time?
So it's both. In fiscal 22, the governor's basically limiting, if the formula was in place, the community colleges would get a far higher level of funding. And as a result of capping the funding, we make about $25 million worth of savings. But there's a second piece, and the second piece is that the governor's proposing to change the funding formula in the out years so that it's no longer linked to enrollment and FTES funding at the universities. It's basically just going to be linked to general fund growth. So it's essentially the same provision that he proposed last year, which the legislature rejected. But there are two things going on.
Okay, thank you.
You're welcome.
Thank you. Mr. Powell, I'm sure you will probably get some follow-up questions from members of the committee, but we really appreciate it when you come and share your expertise with us. Let us move on to hear from Ann Wagner and Andrew Garrison. It's 2:15 now, so I'm sorry we're running a little bit short on time, but let's hear from Ann first. You ready?
Great, thank you very much for having me. Thanks to the chair and members of the committee. So Simon provided a very large overview of the entire budget, and this next presentation will kind of zoom in straight to the Maryland Department of Health and show an overview of their budget for fiscal 22. Can everyone see the screen? Okay, great, thank you. So this first chart shows the recent spending in the Department of Health over the past 5 years. As Simon said, in fiscal 2020, you're seeing the COVID-19 federal funds show up. These are the two bars up here. This purple bar shows the reimbursable funds the department has received from Fema for a lot of COVID-related spending. Before 2020, the department had about a $14 billion budget. This jumped up to $16 billion. And then in fiscal 2022, the department actually grows to $16.9 billion. And while the 2020 growth was mainly federal funds, in 2022, this is mainly state general funds. Just to go over a few 2021 actions, the proposed budget includes deficiency appropriations that would add funding to the current fiscal year. That budget would add about $268 million for COVID-19 expenses, and then $87 million would be added to fiscal 21 to reflect the decision of the governor to accelerate the 4% provider rate increase from taking effect in the beginning of fiscal 2022, and that was accelerated to January 1st. And so that cost $87 million in fiscal 21. On this next chart, this goes over a couple pages and shows an itemized list of the changes in the department's budget from fiscal 21 to 2022. That it amounts to a $604 million increase, and I'll just briefly go over a few major changes. In the Behavioral Health Administration, the budget increases by about $181 million. Almost $150 million of this growth is for expanding services and projected enrollment in behavioral health services. Skip ahead to DDA. DDA shows $73 million of growth. Of this, $55 million is to expand services and provide more community services to people off of the waiting list. And then the largest growth in the department is driven by the Medicaid program. It accounts for about $438 million of growth in fiscal 22. $250 million of this is related to enrollment and service utilization expected in fiscal 2022. So like Simon talked about in the fiscal briefing, the state does expect to receive a significant amount of federal aid for the COVID response. And this table, again, zooms in specifically on health-related federal stimulus. Again, the largest source of federal funds for the department in fiscal 2020 through 22 is the enhanced Medicaid federal match. It's estimated this will add about $935 million to the budget. And this actually did not reflect the Biden administration's announcement about extending to December of 2021. So this is actually understating what the state expects to receive in enhanced federal funds. The next greatest source of federal support was through Fema reimbursements. The state expects to receive about $818 million in reimbursements for FEMA, and that's mostly due to reimbursements for the state's PPE procurements and ventilator procurements. And then in terms of the coronavirus relief fund, we expect about $684 million to be spent on health-related spending. The coronavirus relief fund overall allocation to the state was more like $1.6 billion, and the remainder was spent on business assistance and many other purposes. But we tried to focus specifically on the health-related spending here. Down here, you can see some of the federal spending or federal allocations for testing and contact tracing, for vaccine distribution. This funding mainly comes from the CDC. And just to reiterate, the December stimulus package is not currently reflected in the budget. So that would be about $467 million in aid from the federal government that we expect to be added to the budget at a later time. Overall, this amounts to above $3 billion in federal aid coming to the Department of Health. We also included a few federal aid that comes through the state but wouldn't show up in the department's budget. This includes $2 billion in direct federal grants to healthcare providers, and then direct grants to the 5 most populous counties in Maryland. And this is from the Coronavirus Relief Fund. So that's another $2.7 billion that should be coming to the state, but won't be reflected in the department's budget. So then this chart, so like I said before, the department will receive above $3 billion in federal aid, but the budget currently only reflects about $2 billion in federal assistance. About $841 million is reflected as the enhanced Medicaid match, or 43% of that $2 billion. About 33% is shown in PPE spending. And then 13% of what's actually budgeted is funding that was distributed to county governments and local health departments. And so that leaves above $1 billion, with about half of that being the December stimulus that's not currently reflected in the budget and would have to be later added either through the budget amendments or if the governor chooses to propose a supplemental budget. That's how you'll see that additional $1 billion. So then next, Simon will provide a quick overview of Medicaid enrollment trends.
Yeah, we thought we'd just throw this in there because obviously the Medicaid program growth has been significant in the last 10 months. The top chart just basically shows that, you know, the budget going in last year was expecting 0 enrollment growth, in fact, slightly declining enrollment growth. But the growth in the last 10 months has been staggering, well over 40,000 people. And we're up to coverage of over 25% of the state's population at this point. At the bottom, you can see the map that just kind of like shows you where that enrollment growth has been. Predominantly, the strongest area of growth has been in the Washington metro suburbs. Part of this, though, is because, you know, it's a little distorted because the level of Medicaid enrollment prior to the pandemic was lower, but still, it's pretty staggering to see that level of growth, especially in Montgomery, Prince George's, and Charles County. Anne?
Okay. So then we'll take a quick minute to talk about vacancy rates in the Department of Health. Overall, department-wide, the vacancy rate as of December 2020 was 10.5% vacancy. This was driven by vacancies in the Medicaid and in DDA facilities. And then there's also notably a 12.1% vacancy rate in Prevention and Health Promotion Administration. And this is the office in the Department of Health that handles a lot of the state's public health, for example, Office of Infectious Diseases and a lot of the public health activities in the state. And so we just wanted to highlight the fact that the department continues to show double-digit vacancy rates and that this has impacted the state's ability to respond to the pandemic, as you're seeing large numbers of volunteers needed, the public health infrastructure that was in place at the start of this pandemic, and how the department has played such a critical role in the state's response. So it's concerning to see 10.5% vacancies, and it's concerning to see the state employees needing to be diverted from other programs to the health response. So that I'll move on to the issue discussion in this analysis. The first one, we go over some of the impacts of the COVID-19 pandemic on healthcare providers and some of the federal and state programs that have been made available to provide them assistance. So first, Simon will talk about some trends in Medicaid claims recently.
Thanks, Anne. We don't have like full data for looking at the total impact on healthcare providers generally, but we thought it'd be kind of interesting to see just the data we do have. We have good claims data for Medicaid to see what the impact was for providers in the Medicaid program. And you can see it's pretty stark that in the fourth quarter of 2020, which is essentially April, May, June, the claims spending in Medicaid fell pretty significantly on a percentage basis. The total amount of dollars going out didn't fall that much, but I'll talk, it's a little bit misleading when you kind of see that because some areas actually did increase pretty significantly. But there's definitely a slowdown in spending in the Medicaid program in that fourth quarter. If you go to the next slide, this is showing by type of service the change between the third quarter of 2020 and the fourth quarter. And I also put on there in the blue, the change from the third quarter to fourth quarter in terms of claims for 19. And I did that because the third quarter is always a little high anyway, because it's the winter months, right? You expect more claims, more services being provided in winter. And there's always potentially a drop off from the third quarter to the fourth quarter. And you can see that, for example, in inpatient, outpatient for 2019. But the drop in service provision in terms of claims change between the third quarter and fourth quarter in all other areas is really pretty stunning. Dental services, the claims dropped by over 70%. Long-term care was down. The only area that was really up in fiscal 2020 in the fourth quarter was the MCOs. And that's because MCOs get capitated payments. So the more people they enroll, the more money they get. And that's the only area where claims grew in the fourth quarter. In the next slide, just want to show that we showed on the first of these sets of slides, we showed that claims were going back up again in the in this fiscal year. But I think it's important to note that some areas claims are still down. So what this slide shows you is the second quarter claims this is a dollar amount, second quarter claims in fiscal 20 compared to the fourth quarter claims in fiscal 20. That's the drop we've just talked about. And then the second quarter claims in 21, that's the quarter we just finished. And you can see that for the most part, a lot of the spending is bouncing back. Dental has bounced back a little bit. It's still about 8% lower than it was in the same period last year. But the area that's really struggling is in long-term care. And that's because, frankly, it's all in one area, and it's nursing homes. Nursing home spending in the fourth quarter was significantly lower than in the corresponding rate last year. And that's all to do with the amount of patient days in those facilities that Medicaid's supporting. So there's definitely was an impact on providers. And if you go to the next slide, this begins our discussion of the funding that was available to providers. The biggest funding that was available to healthcare providers was actually at the federal level through the Health and Human Services Department. And it was the Provider Relief Fund. And about $178 billion of this funding has been allocated to support healthcare providers nationally at this point. None of this money, as Ann says, goes through the state budget. If you go to the next slide, this just shows you how much has been actually received by providers of that $178 billion. This was data that I pulled earlier just at the end of last month. So $178 billion is available, but only $102.5 billion is actually gotten to providers at this point, of which $2 billion has gotten to Maryland providers. If you look at the next slide, just shows you, and this is from a slightly earlier cut of the data in December, shows you where the money's gone. Most of the money's gone to hospitals, about $1.4 billion, nursing homes, $139 million, other providers, $416 million. This should not be surprising because a lot of the specific funding that was included in the Provider Relief Fund, the targeted funding, has gone to hospitals and to nursing homes because those are the facilities that have obviously experienced a lot of the demand related to COVID. If you go to the next slide, Ann, this just sorts the data of the money that's been received in Maryland, the $2 billion, gives you a sense that a very small number of providers, about 36, which are all hospitals, have received the bulk of the funding. The smaller providers, which make up most of the actual number of providers in the state, have received a very minor share of the funding that's available. Ann?
Great. So next I'll go through a couple of the other state decisions and programs that have provided aid to the healthcare providers in the state. The first being the provider rate increase I mentioned before, and that moved up the 4% rate increase again from July 1st to January 1st of this year. The state also provided PPE in some cases to healthcare providers. And an example of this is that as of November 10th, DDA had reported that they provided 5 rounds of PPE to their licensed providers. The state also offered strike team support and mobile medical units to nursing homes and covered some of the costs of testing in nursing homes. And then finally, I think should be of interest to this committee specifically is that the state did expand telehealth services. Of course, the emergency legislation passed at the end of last session allowed the governor to expand telehealth services and Medicaid coverage of these services. And then subsequent executive orders further expanded telehealth. And so this allowed for Medicaid to cover services provided over audio-only technology and other changes like that to expand telehealth. And it is worth noting that right now the telehealth expansion changes are scheduled to end with the end of the the state of emergency. It would take an executive order or legislation to expand this extend this past the end of the COVID-19 pandemic. And there are multiple bills before you this session that would extend telehealth services and the expansions that were allowed during the pandemic. For DDA and a few Medicaid providers specifically, there was also an appendix that allows, so for these providers that participate in Medicaid waiver programs, DDA and Medicaid had applied for an appendix from the Centers for Medicare and Medicaid Services that allows some program flexibilities. This relates to telehealth, as this second item shows that DDA providers were authorized to offer remote services and telehealth in some cases. And this emergency preparedness and response appendix also provided some financial assistance to DDA providers. DDA was able to provide retainer payments up to 30 days in the event that providers couldn't offer services due to the pandemic. And in fiscal 2020, DDA reported that they spent about $18.4 million on these retainer payments. And so while these program changes affected DDA and certain Medicaid providers, it actually didn't apply to behavioral health providers. And so I'll turn it over to Andrew Garrison to discuss the behavioral health providers at this time.
Thanks, Ann. So as I mentioned, the Appendix K waiver did not apply to the behavioral health providers, and what was in place instead was the estimated payments from the ASO transition. And of course, that estimated payments actually predated the pandemic, going back starting in January 1, 2020, when the launch of the new Administrative Services Organization did not go as planned. And those estimated payments actually extended out into August of 2020, so well into the pandemic, about 30 weeks or so from the start date. And how those estimated payments worked is they were based off of 2019 services. And so when the pandemic hit and service utilization decreased for a lot of the behavioral health providers, they were getting paid off of services that they were doing in a fuller year, where with higher service utilization. And the estimated payments as they were structured was ultimately going to have a reconciliation between the services they actually provided during that period and what the department paid them. But because the estimated payments continued on during a period of lower service utilization, the department currently estimates that they've overpaid providers about $163 million that will have to be reconciled. And there's some concerns with this that we have bulleted here. First off is that because of the types of services that are offered throughout the behavioral health community, some of those aren't necessarily evenly distributed. For instance, a residential provider might have had a harder time adjusting to the pandemic and had greater decrease in utilization than someone who might have been able to do more community-based services and transition more easily to telehealth. So those providers would ultimately end up owing the department more than other provider types. And then another concern is that like many providers, the behavioral health providers had to have increased health and safety measures, increased PPE expenditures, but a lot of them were hesitant to use their sort of surplus from these estimated payments, those overpayments, to pay for those, knowing because when the program was set up, they were going to be required to pay that back after this period ended. And then scrolling down a little bit more, we have two more concerns. This reconciliation process is going to be going on. The department currently estimates around starting in April or May of this year, and then going on well into the summer. And this itself is an administrative burden for these providers, particularly some of our smaller behavioral health providers in the state. And then lastly, once the number is agreed upon as to what an individual provider may owe the state from these overpayments, the services that are being provided by those providers might still be depressed a little bit from some sort of tail effects from the pandemic. And so the ability for those providers to repay the state might be further hindered as well. We do have one last program that the state did, grants to both DDA and behavioral health providers that Ann's going to cover.
Thank you. So yeah, this last source of financial aid for BHA and DDA providers specifically was that about $10 million in coronavirus relief funds was earmarked for grants to licensed BHA and DDA providers. I'll note that 50% of this funding went to DDA providers, 24% went to BHA. And then there was about $2 million that actually went back to the Department of Housing and Community Development and was reallocated to other nonprofits. So this $10 million was undersubscribed, and this was because the DHCD indicated that they didn't receive up to $10 million in requests from DDA and BHA providers. So while $10 million was available, $2 million was reallocated to other nonprofits after not receiving $10 million in requests. So that is the end of our discussion on the COVID impacts on providers and then the state and federal programs meant to assist those providers. Moving on to this next issue, I'll briefly touch on some of the COVID-19 data that highlights some of the racial and ethnic disparities that has been made clear and, is these are existing racial and ethnic health disparities in social determinants of health that the pandemic has just highlighted and emphasized over the past few months. This is a national trend that among non-Hispanic African-American individuals that they're showing 1.4 times higher rates of COVID-19 cases in CDC measures. And then Hispanic individuals are showing a rate of COVID cases that's 1.7 times higher than non-Hispanic white individuals. And so looking at Maryland specifically, we wanted to compare Maryland's level of how disproportionate the cases have been among non-Hispanic African-American and Hispanic communities and comparing this to nearby states. And so what this chart is showing is this is the difference between a race's share of the total state COVID-19 cases reported and the share of the state population. So any bar that is above 0% would show that that community is, or that race is overrepresented in the number of COVID-19 cases reported in the state. Anything below 0 would mean that that group is underrepresented and is not showing as high rates of COVID-19 cases. You're seeing that Maryland is showing significantly disproportionate numbers of Hispanic individuals having COVID-19 cases. This is in line with Delaware and Virginia when we looked at these states. But then for non-Hispanic African-Americans, you are seeing that Maryland is showing slightly more disproportionate rates of COVID cases in the non-Hispanic African-American populations. So then we also looked at this in terms of the COVID-19 cumulative deaths. And here you're seeing that, again, African-Americans in Maryland are disproportionately represented in the number of COVID-19 deaths. And it's worth noting that compared to other states, Maryland is actually showing even more disproportionate rates of COVID-19 cumulative deaths. And so we just wanted to, show this as a metric, as a point in time, showing that the national trends that they're showing that there are racial and ethnic health disparities is undoubtedly seen in Maryland as well. The CDC has reported how this has been highlighting how social determinants of health have played a large role in how severe the COVID-19 health outcomes have been for minority communities nationally and in the state. And so we wanted to include these measures as while looking at the department. And then I know the committee talked about a lot about vaccines and the vaccine rollout yesterday. So this data just shows the percent of doses administered. And this is as of January 22nd. So of course, this is a rapidly changing vaccine rollout. And so just at that time, we wanted to show that the initial rollout has been disproportionate in terms of which races have been receiving COVID vaccine doses. So while African-American Marylanders make up about 30% of the state's population, they're only showing about 15% of the total vaccine doses administered. And then in terms of the Hispanic population, the Hispanic population is about 10% in Maryland, but is only accounting for about 4% of the doses administered in the state. And so this is just especially concerning because of the fact that COVID-19 cases and deaths have been disproportionately impacting these communities. And then you're seeing the initial vaccine rollout not reaching these communities in a proportional way. And then we provide a few more pieces of information on how the Department of Health has tried to respond to these racial and ethnic health disparities. For example, early on in the pandemic, the Office of Minority Health and Health Disparities reported actions such as increasing testing sites in minority communities, and then utilizing partnerships with community-based organizations and HBCUs to provide more resources. And then I know the department yesterday also discussed the education campaigns specifically on vaccines and the state's Go Vax campaign. Other than that, for the sake of time, I'll skip over these last few sections, but the report does include information on diabetes prevalence and racial disparities. And then there's also a number of appendices that include more detailed budget data. But for the sake of time, I'll conclude the presentation there, and I would be happy to answer any questions.
Thank you so much. Do we have questions from the members of the committee? We can certainly go over a few more minutes if we have questions. I see one from Delegate Hill.
Thank you, Madam Chair, and thank you for that really good presentation. I wanted to go back to, I guess, pages 25 and 26 with Andrew. So Optum had significant problems with their rollout that took several months, and I think we all heard complaints from the providers. So the conclusion is that they've overpaid. You listed a couple of reasons why the repayment is going to be problematic. What was the method used to determine that there was overpayment? Because I'm still hearing from providers that they feel that the mechanism that was used to determine their reimbursement is not accurate. And so I'm concerned about, I guess the question, how sure are we that these overpayments are going to be sustained, or are they going to be appealed? What do you really think is going to happen here? Because this was just a real royal mess up.
Yeah, thank you for the question, Delegate. Yeah, so the 163 number was something that the department submitted to the General Assembly from a JCR report issued last year to address this issue. And so it was sort of, I would say, their first blush at the overpayments and underpayments and the balance. What the department is describing under this assisted reconciliation process is where a provider could say, this claim got denied and we don't believe it should have for X, Y, or Z reasons, because there are still, even after the go live date that they reported of August, providers are still reporting some concerns in the sort of processing of claims. So I think we wouldn't be surprised if that 163 number does come down a little bit, but certainly knowing what we know about when the estimated payments extended throughout and that they were based on 2019, we still do expect at least the directionality of this to be right, which is to say that there will still be ultimately overpayments to the providers, given that utilization decreased during the pandemic.
And just to clarify, even with increased telehealth coverage for audio only and the increasing number of people who required services during the pandemic. So yes, decrease in in-person services, but overall an increase in services. Generally, you're still expecting that to only go down a little bit.
Again, the degree to which I'm not exactly sure, because a knock-on effect of this has been that the claims data that we usually receive, which is usually pretty good and could help us with the utilization question as to who is perhaps rebounding better than others, that has also, of course, been impacted by this. I have been working with the department to get some better information on which sort of provider types saw the most overpayments or underpayments, again, largely overpayments, and that should at least proxy for where utilization has rebounded. And I would anticipate that, perhaps, again, outpatient-based providers did have a better response than some folks who are doing residential or more intensive in-person treatment.
Right, thank
but
you.
even on balance, I would still expect it directionally be right.
Thank you.
And Delegate Szeliga.
Thank you, Madam Chair. I would like a little more explanation about the charts on page 29 and 30. And if 29 seems pretty self-explanatory about the number of cases of COVID, but can you explain chart number on page 30, exhibit 11? I'm specifically looking at the Hispanic numbers. Are you saying that Hispanics got COVID at a higher rate but experienced fewer deaths? I'm a little confused.
Yeah, that is actually what this trend is showing. It's showing that in terms of the cases, yes, about 19% of cases in the state were made up of the Hispanic population, while they only make up 10% of the state population. And then in terms of COVID-19 deaths, Hispanics in Maryland are not showing higher rates of deaths. I think initial preliminary studies in this trend has been seen since early on in the pandemic. So, I mean, research is still pretty preliminary on this, but I think this does have a lot to do with overall age of this population. And I think that over time, there will be a lot more research and a lot more, reasoning behind why you're seeing these trends. But yeah, you are reading this correctly, that they are showing much higher rates of COVID cases, but then not rates of COVID deaths in the state.
Thank you.
Great. So do we have any more questions from members of the committee? I don't see any more questions. So I think we will thank you very much for your time and your presentation. Really appreciate it. And we are going to convene in half an hour for our bill hearings to the members of the committee. So it's, let's say, 2:50 now. That will bring us back at, who can do math, 3:20. So we will start our